Hi everyone, my name is Dr. Shyam and in this video I will discuss very important MCQ. Here 58-year-old male with history of chronic smoker present with sudden onset severe chest pain radiating to back for last 2 hours. BP in the right arm is 180 by 100 and in left arm is 150 by 90. BP difference between two arms and pulse is 110 per minute. ECG suggestive non-specific STT changes only. Troponin is negative. What is the most appropriate next step in the management? So here, 58-year-old male, chronic smoker, and there is a BP difference between arms. ECG non-specific changes. Troponin negative. So most important clinical clue. Most important clinical clue: chest pain radiating to back, chest pain radiating to back plus BP difference between arm. Okay, this should be immediately make you think of aortic dissection. Okay, so if in question chest pain which is radiating to the back and there is a BP difference between arms, so always think aortic dissection. Okay, and not MI. Why not MI? Just because there is a troponin is negative and non-specific STT changes. Okay, so MI is ruled out here, so it is a not MI. So let's rule out option one by one. Option A is start thrombolysis immediately. Why wrong? Option A is wrong. Why? Because thrombolysis is given in STMI. Okay, in ST elevated MI we will thrombolize the patient, and here ECG does not show any ST elevated MI and troponin is also negative. Okay, most important, if this is aortic dissection, thrombolysis can cause fatal bleeding. Okay, so here diagnosis is aortic dissection, and in aortic dissection thrombolysis is contraindicated. Okay, so option A is wrong. Option B is also wrong. Start IV heparin. How? Why wrong? Heparin is used in acute coronary syndrome, and in aortic dissection anticoagulation increase risk of rupture. Okay, so heparin is dangerous here, so option B is also wrong. Option C. Option C is start IV labetalol. Okay, first see the option D, then we'll discuss about option C. Option D is also wrong. Why NTG is wrong? Because nitroglycerin reduces pain but does not reduce shear stress adequately. So in aortic dissection, what is your priority? In aortic dissection, reduce heart rate first. Decrease the heart rate, okay, and then reduce the BP. It should be your first priority. Next step, if any patient presenting to you with chest pain radiating to back, and you will take BP difference between arms, so think about aortic dissection. So always give labetalol to reduce the BP as well as heart rate. So nitroglycerin just reduce the pain only. So NTG alone does not control heart rate. So option D is wrong. Why option C is correct? Option C is correct. Labetalol. In suspected aortic dissection, first goal is I told you to reduce shear force on the aorta. How? How you will reduce the shear force? Just by reducing the heart rate and by reducing the systolic blood pressure. Okay. So IV labetalol reduce the heart rate and blood pressure. Okay. So final diagnosis here is acute aortic dissection. Option C is correct option. So whenever you see chest pain radiating to the back with unequal BP in the arms, think beyond MI. Okay, think aortic dissection. So it was a very important MCQ for your NEET PG and INI CET. So option C is correct.